All right, I believe, are officially live. Welcome to the GLP-1 Pill Era workshop. Hey, I'm Dr. Angela, your favorite go-to obesity medicine specialist. I've been an obesity medicine specialist since 2012. I did not pop up overnight. Been helping patients lose thousands and thousands of pounds through the years, even without GLP-1s. And fast forward to today, guess what? They make my life much easier. But if you are new to us, pop up below, let us know, say hi, where are you coming from? And for those of you who are current patients, welcome. So glad that you are part of us because, as you know, I am your credible resource to get you through all of the noise of what the internet is saying and what do you need to know behind the scenes, the real facts. So guess what? I'm going to actually fast forward for you and give you the ADD version of what you need to know so that you don't need to just hear all the fluff of this 10 minutes of where I came from, what I do. This is what you need to know. Okay. So, literally breaking news. Eli Lilly, one of the biggest pharmaceutical companies, made a huge announcement that FDA just approved their first launched GLP-1 pill version. That's right, no more injections, okay? Now, I do want to give you, some insight. Remember, Eli Lilly has a competitor, Novo Nordisk, okay? They launched their pill called Wegovy, which I refer to as Ozempic's sister, the pill version back in January. And as of the date of this workshop today in April, Lilly says, not so fast. We're getting our own pill version. Guess what? We are going to dominate the market. Okay, so here's what you need to know about the latest and greatest of what's hitting your feed all over the internet. Okay, so the name of this pill, which is a GLP-1 pill, is called Foundayo. Inside joke, we're calling it Fandango. Sorry, I don't know where they come up with these names, but I'm calling it Fandango. So if I say Fandango by mistake, you know why. So, but it comes in multiple doses, okay? So it comes at a very low zero point 0.8 milligrams and shoots all the way to 17.2. That's a really wide spectrum. That's the first thing that you need to know, okay? The second thing that you need to know that is why it makes it so unique. It literally can be taken with or without food, with water. There's really no restrictions or special instructions. That's actually what is, quote, superior about it. Keep in mind, for those of you who potentially are already on the Wegovy pill, that one is your picky second child. It's the one that requires to be taken at least 30 minutes to 1 hour on an empty stomach with just water first thing in the morning. Now, for the most part, that's not too difficult, but it's so picky that if you mess things up, you actually absorb it differently and you may not get the effects kind of thing. But, Fandango, you take it any time of the day, doesn't matter, and it's good to go. Okay, so that's actually the most important that you need to know that you can literally take it any time of the day, doesn't matter. If you travel a lot, it's amazing because you could be in Italy and you can be in completely different time zone and you can still take it regularly. It does not require refrigeration. It is portable. And what I love about pills as opposed to injections is if you have a sensitive stomach, meaning, gosh, I look at a bird and I get nauseated. I just really, if I change one thing out of my diet, I automatically get constipation. Okay. So you've heard the word on the street that these injections, the GLP-1s, can really have side effects on your stomach. The cool thing about a pill is that as opposed to injection, which is once weekly, the injection stays in your system. So you're sort of kind of like SOL if you have side effects. You got to wait, several days up to a week for it to just kind of get out of your system. Okay. For the pill, it has a shorter half-life, right? It's not in your body as long. So on one side of the equation, if you have a sensitive stomach and you just don't have really good response to it, no problem, you stop. Okay, and it's out of your system pretty quickly. Okay, on the opposite, it tends to be can be more gentle on your stomach. So if you are just so scared about the GLP-1 side effects, the pill is the perfect tiptoe into the water kind of method. Okay, so that's what you need to know. More dosing doesn't have any restrictions when it comes to taking it. The third piece of it is that, believe it or not, the pricing compared to Wegovy pill is comparable. Okay. Of course, Eli Lilly wants to dominate, and so they are going to literally match the same pricing as the Wegovy pill. So, as of right now, the lower doses start out roughly about 149 a month, okay? But remember, anytime that you go to these websites and small fine print details, there are terms and conditions and things around that. So just know that the lower doses are going to be 149, but just friendly reminder, as you go up into the higher doses, that's when the price increases, okay? I believe with Foundayo, it will go up to 199 as you start to bump up into, the higher doses. And the very, very higher doses, it will cap off at 299 a month. But again, very similar process to the Wegovy pill. Okay, so quick snapshot. That's really sort of kind of what you need to know as of right now. The head-to-head from Wegovy and Foundayo. Okay, they're both GLP-1 pills. They both produce a significant amount of weight loss. And what do I mean by that? Foundayo is roughly on average about 12%, typically at the higher doses. Okay. So, I mean, we're looking at like even just under 30 pounds in like, several months on it. Okay. So this is pretty significant compared to like old medications where there were only like 5 to 10%. Okay. But both of them are comparable when it comes to real weight loss. So if you've been someone who's just been stuck, you've really just can't figure it out, you've tried your diet and exercise, your body's just kaput, this is a really good place to start, especially if you haven't even like ventured into, the injections. Pill is sort of kind of like that more baby step. Oh, thumbs up, baby step to introduce yourself into the GLP-1 world. Okay. I will help you with the doses. Friendly reminder, we do intend to start at a low dose because, yeah, we want to manage the side effects. Some people may not feel a single thing at the low dose. I want to give you a heads up. Okay, because it's so low, you might kind of feel a little bit of appetite suppression, but you're like, what's the whole fuss about this? Why are everybody else losing weight, not me? Okay, just friendly reminder, the lower doses are designed for a reason to ease your body in, but you are going to require higher doses in order to really get the effects of weight loss. Okay, just to give you get insight. I mean, I've been prescribing this, ever since it hit the market. I find if you require more weight to lose, typically those who are needing to lose over 50, closer to over 100 pounds, 100% you're going to need the higher doses. Okay. Those who also come with more complex additional medical issues, let's just say maybe you're on high blood pressure medicine or cholesterol, or you have chronic pain, or migraines, thyroid problems, just a little bit of a mix in the pot, if you will. You will most likely require higher doses. Okay, so don't get too caught up on this stuff doesn't work. Just know that if you have a complex metabolic system, which I can walk you through, if you hop on a call with me, I will give you a more realistic picture of how you're going to respond. Okay, on the flip side of the equation, those who need to lose maybe like less than 20 pounds, the sweet spot is 10 to 15. You don't really take a lot of medications. All you take is vitamins and supplements. You have kind of a sensitive stomach. You're not really into taking medications in general. This is perfect for you. Okay, you might actually even like respond right away. So the cool part about it is that you possibly could stick to lower doses. But again, that's just sort of like a theory and a guess. I don't know in everybody, but I've seen those individuals who have a not as many complexities to the mix will respond sooner. Okay, so that's what you need to know. Um, I do want to give you some more complex insights, especially for those of you who are already members, okay? We've already had a lot of people reach out to us. If you are already on an injection, doesn't matter which one, whether you're on Wegovy, Ozempic, Mounjaro, or Zepbound, just to let you know, injections will always be superior in the effectiveness over pills. Okay, so for those of you who are already on an injection and you still need to lose weight and you're okay staying on an injection, you're okay on paying a little bit of the higher price for the injection, stick to the injections. Okay, you can change to pills for a variety of reasons, meaning I'm just tired of the needles or I travel too much. I need to save money, absolutely. Okay, but just know that if you are doing injections and you still need to lose weight and you switch to a pill, it will be considered a downgrade type of experience. It may not be significant. We never know. We can always try, but I do want you to know that it's almost sort of like this you know, I don't know if I can keep you in the ballroom with Cinderella. Clock strikes midnight if we, kick you back to the basement with a pill. Okay. So just know that the injections will always, always be superior. Now, if you are on an injection, particularly Wegovy, okay, and you are at maintenance, those are the people that I would say maybe we could switch to the high dose pill version, save you some costs. Now, there's still going to be a subtle step down from injection to pill, but it's an exact match. Okay. So, but if you, again, work, travel, don't have access to refrigeration, just tired of the needles, but you're literally at goal weight, those are the ones that I would say, we could consider switching you to the pill version, but we would need higher doses of the pill to match the lower doses of the injection. Okay. There is that small risk where if we do a step down, that we might gain weight back. And so we need to sort of kind of really stabilize that. Okay. For those of you who are on Zepbound, it's the best of the best. Okay. If you don't have to switch, don't switch. I don't recommend it. Zepbound is literally, the pills currently only have GLP-1. That's one peptide. Okay. Zepbound has two. It has GLP-1 and GIP. There's a reason why it actually is best to date. Kind of almost knocks Wegovy and Ozempic, out of the park. So having access to it, yes, it costs a little bit more, but it's absolutely 100% worth it. Now, keep in mind, I know that a lot of people just say, gosh, these medications are so expensive, and they are. But remember that don't look at the price superficially, okay? Just because you're spending 149 a month instead of 449 a month, and I know that's a big gap, the 149 may not even work. In my mind, that's actually more expensive than the 449 injection that is a no-brainer. Okay? So please keep that in mind when you are trying to save costs. Just because you're paying a lower price actually doesn't mean that you're saving money. Okay? So I will have that conversation with you. Okay? But those of you who are on Zepbound, who are able to make that investment on a regular basis, absolutely. Yeah, it kind of stinks because it's like a car payment, but hey, guess what? You get all the bells and whistles. Okay. Now, here's the cool part about it. Just hang tight. Right now, the pill era just started. Wegovy, is on the market in January. Now we've got the Fandango pill now available through Lilly Direct. There will be a Zepbound pill version coming. Okay. I don't know when, but I feel soon. It's already in the works, just to let you know. I believe that Foundayo just was the easiest to get FDA approval. Okay, so that's just sort of why you're seeing it. Okay, again, remember, these are just GLP-1s. They are like the basic bottom of the start of these kind of this new area of weight loss medications. Okay, but stay tuned. The pill version of Zepbound will be available. And as you know, we pay attention to the news all the time. So you guys will be the first, to get some more information about me. Just to also give you a heads up, Eli Lilly, this is again, I'm only predicting either, I'm guessing probably more like next year or so, but they've already have talks of a new injection that's even better than Zepbound. Okay. And it already has a nickname. It's called triple therapy. Okay. So while Zepbound has two peptides, this has three. Now, some of you might be familiar with it. Okay. Sorry to throw out some scientific words, but it's called retatrutide. Okay. Now, I want to give you a heads up. It looks like it's actually available through compounding pharmacies. Do not purchase any of these at all. Retatrutide has not gone through the safety markers and all this stuff. There are, you know, places that are selling it that they shouldn't be. Okay. So as of today, April of 2026, you should not be on retatrutide, thinking that it's safe. Okay. Because it has not have been officially, sort of kind of been to market in the proper channels that it's supposed to. Okay. So right now, Zepbound is the best to go. Okay. So here's sort of kind of the pyramid of sequence. So bear with me. Okay. Some of you, believe it or not, are on a medication that's been around since the 1970s. It's called phentermine. Okay. It's still FDA approved for weight loss. Guess what? It's dirt cheap. You might not even need to be spending like hundreds of dollars a month. It has different side effects for sure. It's not as cool as the injections, but that's sort of like the baseline. If you don't want to spend a lot of money, if you don't need to lose a lot of weight, but you sort of kind of want to start getting some results like phentermine, talk to me. I'll see if you're a candidate for it. But it's still a really good option. Okay. Next is then let's talk about now, okay, just a little bit of a side note. Any of the other older medications for weight loss other than phentermine, you're wasting your time. I'm sorry. You're going to go to your primary care doctor and they're going to, suggest like, Topamax or Contrave or some of these other things that have been around for a while. They don't work. Okay. You're wasting your time and you're just putting yourself through more side effects that you don't need. Okay. So phentermine is just bottom of the pit, cheap, doable. If you're a candidate for it, done. Okay. But if you are like, you know what, I want to be like everybody else. I don't want to be FOMO. Okay. I want to get into the GLP-1s, but I literally just don't want to deal with side effects. Okay. So that's where the Wegovy pill comes in. Okay. So Wegovy pill, again, just little over 10% weight loss. Okay. But it's a GLP-1 version. Funky the way that you have to take it. You got to take it on an empty stomach, 30 minutes to 1 hour before eating, kind of thing. Okay. Starts at 149 a month. Okay. Then again, you have Foundayo. Okay. Foundayo is another option. Why would you choose Foundayo? Just have some more doses. I just like Lilly Direct customer service. Um, like I said, you can take it with or without water. It doesn't have special instructions. That's literally probably the number one reason why I would tell you to choose Foundayo. Is you're just like, my life's just too unpredictable. I got kids and husband that travels and my head's cut off. I take it at noon. That's literally the number one reason why you should choose Foundayo. Okay. But again, just want to give you a heads up. As of right now, Novo Nordisk still says Wegovy works better than Foundayo at higher doses. Okay. That's from a statistic research trial. I'll let you know once we get more and more patients on both, so I can tell you. But just right now on paper, Wegovy still, despite it being the picky second child, it works better than Foundayo. Okay. But Foundayo has more dosing options. Okay. So you start out really low and then you can like baby step your way up versus Wegovy has like 4 doses total. Okay. So, but those are the GLP-1 pill versions. That's for you. You don't like needles. You don't like side effects. You just kind of want to dip your toes in. This is for you. Okay. If you need something more effective, you need a knock out of the ballpark. I don't want to waste my time. I don't want to guess if I'm going to lose weight or not. Then that's where the Wegovy injection comes in. Okay, GLP-1 injection. Okay, we're not going to talk about insurance. I hate to tell you, right now I barely have any insurances that cover it, but I'll walk you through the whole process, okay? But the technically the Wegovy injection is just the really good, solid, especially if you need like that sweet spot 20 to 30 pounds. This is fantastic. Work with me so that I can manage your side effects, walk you through your nutrition, troubleshoot, all of that, okay? And then if you're like, you know what, I I literally want to invest in my health. I want something definitive. I need to lose, I've been struggling with weight. I need to lose, 40, 50 plus pounds. I literally dead tired. My health is in danger. Um, I literally just want to knock it out. That's where Zepbound injection comes in through Lilly Direct. Okay, this is a lot of information. Okay, I'm super excited. If you are a current patient and you just have so many questions, connect with the support team. We'll get you on a phone call. Okay, let's walk you through, and I will tell you literally, the goods, the deets, and I'll tell you flat out whether you should switch or not. Okay, if you are new to me, go to our website at medfitmedicalweightloss.com. You can ask me anything, literally. I'm the type of doctor that would just tell you how it is. Okay, we're not gonna mess with like what the marketing and internet and everybody's saying. No, you need to do this and you need to do that. I will give you the real insight, but I do need to ask questions about your medical history, what you bring to the table, meaning, are you in your 40s and 50s? Do you have perimenopausal issues? Do you have polycystic ovarian syndrome? Do you have a thyroid disorder or whatnot? There's so much complexities. Or are you just someone who works out a CrossFit 5 times a week and do training fasted and you've gained 10 pounds in the last, 1 year? Okay. These are the conversations that we're having. I hope this was helpful for you. I intend to keep it real, give you the facts of what I know, but this is breaking news. So, but again, for those of you who are currently with us, contact support if you really want to talk to us. And then new patients, welcome to my world. Let me help. Go to medfitmedicalweightloss.com and then let's get you going on the best option. All right, we'll see you later.